Thank you for inviting me here to talk about the nursing perspective about AYE cancer care. Um, as Maria already introduced me, I have several roles in several positions. I worked for more than 20 years as a nurse consultant on oncology and hematology, and I had a special interest in young people. Um, so I have nothing to disclose. And why I had a special interest in young people is this was like I met Ben. He was 16 years old when I started as a nurse consultant role in one of the hospitals in 2005. Therefore, in my nursing career, I never met young people. I was also a nurse consultant on an adult ward, so that mostly in my imagination at that time, also cancer was only for all elderly people. But then I met Ben, and I must say honestly, at that point, I didn't have any idea to handle the situation. It was very specific. I had no idea where and how I can find the right support for him, the right information. And at sometimes he transferred to the university hospital as I was working in a private clinic because he needed another treatment. And he was, in my perspective, lost in transition. And I felt there was something lacking at that point also in Belgium to do with young people on their care. But upon a day, to time, I still hear from him. So luckily, he has a cancer survivor at this point, and still, I had a feeling as a nurse that we couldn't support him that well at that time. He claims that nurses were the most consistent factor in his story, and that's why he still has contact. And one of the points he being keeping contact because he said like you were the person that mostly the consistent in my story, but also the one that I can share everything with. And so that is a very important for my story that we feel connected and listened by healthcare professionals. But as you all know, that being, and I think Ulrike explained that very well, that being a young person, an adolescent or a young adult is a very challenging time, that there are a lot of transitions happening. And I'm always using this picture because I think it's like learning somebody to drive as a healthcare professional. It's like, yeah, guiding young people, helping to move on and to support them. But on the other hand, sometimes it's very challenging for us as healthcare professionals to deal with it. And as cancer nurses, I think we are the profession, like forefront professionals that be there for a long time during their treatment, and one of the consistent factors next to the physicians. So if you want to read more about it, I recommend this book. This is like a book that describes how the brain is working for young people and adolescents. And adolescence, of course, is an element of biological growth. And we see that also taking their position in society. And if cancers come along and people are coming to the hospital and or need treatment, this is continuing. This is not stopping. And that is something we need to keep in mind as healthcare professionals and also for nurses if they are inpatients. This is also continued. This doesn't never stop at some point. We are knowing this is a unique group and their brains working differently. It was nicely explained already by Ulrike. So that is something we need to consider if we are talking about caring for young people. And we see there are physical and emotional changes during adolescence. And we see that a lot of things are changing, pushing away from parents, higher authority. But that's not only parents. If young people are admitted at a ward, for example, it's also to physicians, nurses, psychologists, the whole multidisciplinary team. They want to socialize more with peers, and that we see that is also a very big challenge in hospitals to being in peer support and trying to things doing on their own way. So as we as healthcare professionals have a lot of information and try to think, push a little bit with our patients, this is also working reversely at that moment. And that is what we need to be aware, especially if we are like 24 at 7 with the young patients, how to deal with. Also, nurses are a unique group. We see over the years we developed from awareness to in survivorship care plans where traditionally nurses were involved in just administrating chemotherapy in cancer care. This is evolved by to the whole care pathway, and we have a role also in AYE as it developed quickly in the last decades. We see there is a lot of already information outside there that we can read and use on everything what's happening in AYE and also in nursing care. There is a European Oncology Nursing Cancer Nursing Education Framework. This is a framework that outlines that the knowledge and the competences of cancer nurses, and this is also including AYE cancer care. And also what we see in the UK, for example, if you look into more specific thing, they developed over the last 2 decades a lot of information about how quality care can be looked at, but also, for example, the nursing competence framework, what is needed to be a cancer nurse working in AYE cancer care. So with this outline, I think it's very important to state that education and training is key, and that's why it's so great we have this training today and these 2 days with fantastic lectures and a lot of information. But also for nursing, with some colleagues in 2018, we wrote a book about like nursing and young adults with cancer, like for example, what is specifically for nurses important to take care of. And as I said, for example, we started in the last decades by just being aware about treatment and administration of treatment. I think nurses at this point have also a big role in creating awareness and prevention around cancer. And we all know, for example, that the diagnosis is mostly or a lot delayed in young people, and that has the reason about different factors. It's like we are still not have the intention to think it's cancer with young people. We miss like for example the signs and symptoms because they are related to a lot of different factors in adolescents and young adults who, for example, tiredness, fatigue, loss of weight. That could be different things in young people, and luckily it's not that much cancer, but if it's cancer, it's important to be aware and to, as soon as possible, go into the right clinic, physician, and treatment. And this, I think, this is something I very much like, the CATS awareness. This is developed by in a university by young people themselves. So I think as healthcare professionals, it's important to use these tools and to send them out. And especially when we teach, for example, and I think we as healthcare professionals, sometimes we come in schools or we go into the communities. I think this is important task also for nurses to put out prevention. And especially in prevention, I think it's also like increasing the health literacy, but also to teach how they can, for example, to do self-examinations. Because mostly my classes I do with young people in the nursing community, I always use these slides and before I start my class and then ask like, are you aware to do a self-examination, for example, with young women in breast cancer, but also men that I ask like, is that something you learned and where did you learn this? So as a healthcare professional and as nurses, we have a big role in this to create prevention and also the increasing the health literacy and self-examination. And with this, maybe we can prevent, but also when it's necessary, we can also decrease the delay in diagnosis and that people as quickly will be diagnosed of getting the right treatment. So, but then unfortunately, some young people are confronted with cancer, and we did some investigation in our university, and we felt with young people that get the diagnosis, it's mostly what we felt on nursing wards is also that there's a lot of things that they are confronted with at a very, very short time. There is a lot of information. There is also a lot of decisions had to made. There is also a lot of stress, like Ulrike already told. And in that point, there is a great need of certainties and information because suddenly everything is becoming uncertain, not only for the young person, but also for the parents and maybe the siblings that are there also there. It's a big short time of a lot of transitions that also needs to be made. So we see a lot of information, a lot of different caregivers also at that point. We see, for example, physicians, nurses, psychologists, maybe some physiotherapists, surgeons, and this could be overwhelming. And what we feel as nurses, if people are admitted also, they want to come to the hospital and as quickly start with treatment. And like, for example, after the treatment, the cancer will be gone. But unfortunately, that's not always the case. And also sometimes need to be quick decision making. Think about, like, for example, about fertility. So how we plan on this as a nursing role? So nursing services should be structured to allow continuing on the AOA life, including what we already discussed, like for example, all the challenges in life, like education, the peer support, sexuality, fertility, family life. And we're striving to continue in the nursing services and during the administration of their treatment to the normality of AYE activities. Unfortunately, up until today, that's not always the case. Also in our hospital, we had to make a big shift because if you maybe think about your own services where you work, how is the evening arranged on the wards, for example? I think in a couple of years ago, it was still like we say, like at 8, 9 o'clock, it needs to be quiet. Could you imagine with adolescents and young people to say like, yeah, at 8 o'clock you need to be quiet, the light needs to be on, and you need to be sleeping? That's not always the case, and that is also not always working. So I believe that the nursing professionals, they're aiding the process, they're helping the process in normality during these challenging times. But why it's so important to make that connection, and especially during treatment and from the nursing perspective, as this healthcare professional or the most consistently in their trajectory, is like improve the results of the AYA experience. I think this is very important, especially if people have to come back to services on the long-term survivorship. It was already said, like coldness, it doesn't help the experience that people have to, for example, to come back or to make the connection back. It's also very essential during treatment for nurses specifically to have like that connection, because to identifying and addressing the specific physical, psychosocial, and emotional needs, but also think about like side effects of chemotherapy, we need to have that connection so there is a strong connection and quick decision making if something is happening with young people. And it help reduce the anxiety and stress experience during and after the treatment. So if people thinking back on the treatment, it's good to have like the best experience they could have during treatment. Also, we need to be aware about not only the physical, and that's also treatment related, but it's more than that. It's just AYA, so young people, adolescents, and young people are confronted with cancer, and this makes a life disruption in their life. So we need to be aware if they are admitted that they are not small children or not small adults. And I think this is sometimes very challenging. And from a nursing perspective, it's important that we can take in and give the right place to the right young person. And what I mean sometimes, it's like, for example, it's sometimes divided by the silos of the law, how the healthcare system is structured. For example, in Belgium, if you're up to 16, you're on pediatrics. From 16 to 99, you go into adult, but between 16 and 18 years old, it could be, for example, that you be on pediatrics, but it could be also that you're on an adult ward. And I think if you have like a take in that you could discuss this, it's important to choose the right um, word or service for the young person, because for example, not every 70 years old has already maybe feeling more connected to a pediatric ward or feeling more connected to an adult ward. In some cases this is very difficult. For example, if you have like an emergency admission, for example maybe in a leukemia, this could be a problem, and that is very important also that we can discuss this by also all the psychosocial aspects of the young people themselves. We see, for example, there are a lot of challenges. This was already by Ulrike explained. They have specific developmental tasks, and I think we need to take that interest in the life of young people to make that connection. But at the same time, also very important as nursing, is to maintain a professional relationship. We are still professionals and we need to act this. Even we have to make their agreements, and we also have to set the rules for the treatment and for the admission at the ward. Therefore, it's important to start how to know and to make that connection is like a needs assessment. And I think for us nursing professional, we think this is very important, and this go further than the physical and psychosocial screen that we need only in general for cancer care, but it also, it's especially because a lot of things are happening and the transitions that they are making, it's important to talk about like the home situation, about their educational activities, also their physical activities, their hobbies, what they are involved. But also we know at that age they're experimenting with, for example, with alcohol or drugs. It's very important to know this and discuss this with young people. And that's why we need to make that connection. If you want to go into this discussion and increasing their health literacy, for example, it's important to have that connection and give the ability to talk with your young people about it. And therefore, it's important that we keeping and guarding privacy for young people also on the ward. Sexuality is very important to talk about. Safety. We see not all young people are living in a safe environment. And during treatment, this is very important to maintain this so they feel safe to get their treatment or going back, for example, to where they are next to the treatment. Also, for example, in young people, we see the highest numbers are suicide are among the young people. So this is very important to guard this, as depression and anxiety can also come on during treatment, to monitoring this. And of course, at this time, I think social media and digital connection, we can't think it away anymore. And that is also something where we are confronted in our wards. This is an example from the screening tools. There are many screening tools outside there that including all these topics. So it's important that we use them. And why they are so important, and I think not only for nursing, but this is very important because in the MDTs, these are valuable tools to use and to talk about like how we can continue with treatment. And this sets and this creating a real interdisciplinary use and making agreements on the different levels, physical, social health, and mental health. And we see there are a lot of aspects that need to be discussed. This gives the opportunity. There are also tools outside. There is an example of the IM tool, mostly used in the UK. This is even digital by an app that young people can put in their feelings or their thoughts, or if they are confronted with something. And also this can be outlined in the MDT by a digital way. Um, Other tools, this is something we developed in our hospital. We call it an AYA compass, where we talk and ask on several levels. This was created with young people themselves to do this. And this is very helpfully also for nursing ward to take care. What are the needs? What are the concerns at that moment from the young people themselves? Next, if we want to start a treatment, I think there are some things we can't go around, and it's very important to provide that information and information provision by the nursing. It's very important that we do this age appropriate, but also developmental. And I think there are some things we need to talk about. Information quality, to increase the information literacy, the health literacy, sorry, the quality of life and psychosocial well-being. And for example, everybody, if we're starting with treatment, we need to talk about, because we know about fertility. Unfortunately, we're coming back in the next slide on this. There are several things why we need to do this, but also it's very important to treatment they're staying healthy, and that we need to talk about young people about it. And also taking about safety precautions, for example. Then this is related to sexuality, because we need to also explain about the occupational safety to, when they get the treatment. Talking about the drugs and alcohol during treatment, what can and what cannot can be done, when to worry, and also very special is that they know the signs and symptoms so they can take actions, because we know from also for research that they want to take control. Young people want to have the control to their self, so it's important we give them the tools to create that right control and to take the right actions when it's necessary. Your Guide to Cancer, this is from the Teenage Cancer Trust. This is a developed tool. You can download it free. It's free to use, and it gives like an overview for young people, all the topics they can discuss during treatment and when they have confronted with cancer. And as I told, what is very a special task also for nurses when they patients coming into the ward is always checking on fertility. Because unfortunately, up till the day, we see some people that never had a chance to talk about fertility, never had a chance to have like a fertility counseling. And we know from research that fertility is also a sign of hope, a hope that treatment will be over and they can continue with their life and adult life afterwards. So yeah, sometimes we still as professional failure to discuss risks to fertility, but that not is always with purpose. Sometimes it's all the things needs to go be quickly and there is an emergency admission. So also as a nursing professional next to the physician and all the people that already were contacted, it's important we check this. So if it was not done, that we can go back and firstly have the opportunity to create a fertility pathway. So we create that also that purpose of hope for young people after treatment. And that is something that I think as nurses and patients coming into a ward for treatment, we need to check and even to discuss with back in the multidisciplinary team if there were other decisions made, or maybe people can change their minds over time, because from diagnosis to treatment, sometimes it's going so quickly. And we see that young people never thought before about it, like, do I want children later, or do I want a fertility consultant? And suddenly they change their mind. For example, in our hospital, we had that as a case a couple of years ago, that young person, there was a decision made, and it was in the file. No fertility consultation was asked or was needed. So they came in on the day clinic, so the day they started treatment, and we asked again, like, from our nursing perspective, like, was this checked? Do you have still the same concern? And at that point, the parents were also there, and they said, like, oh, yeah, but we were thinking about it, and now we are thinking about it. That means that we're never gonna have grandchildren. And at that moment, suddenly something's changed, and at that moment, we put a therapy on hold, and we started a fertility trajectory. Also with young people, they had a nice discussion, and after treatment, they were happy that we discussed that again before we started treatment, and gave the opportunity to rethink the decision they made. Talking about sexuality is also very important, especially with adolescents and young people that are in that developmental phase there where they're experimenting, where there is also a lot of things that going on, and we need to increase their health literacy about sexuality. But we know for research that from healthcare perspective, it's also not always easy to talk about this topic, or we are avoiding a little bit this topic. So there are tools outside for healthcare professionals how to start this conversation, but also giving the right information, age appropriate, to adolescents and young adults is very important, and talk about it during treatment. And we see also these are topics that mostly, if patients are admitted in an inpatient ward, that coming at times that they are feeling a little bit lonely, or for maybe in the evening when the visitors are gone, or where there is no connection, and we as nurses come in and they say, like, yeah, if it's about that, we ask something, they ask all questions. And it's very important to handle this and listen very carefully what they mean, because it can be related to their sexual orientation. But also we see, for example, in adolescents, especially that there's some adolescents that were confronted before with sexuality, but also we have adolescents, of course, that have already experiences with sexuality. And it's important to take this on, and if necessary, to refer them and to have this discussion, to refer them to, for example, a psychologist or a sexologist in the service, so they can have support or specialized services. Despite, I think, there is a lot of healthcare professionals in clinics afterwards, we see still that there is a lot of loneliness in young people in the clinics. And I think this is very important for the nursing perspective, the observations when we have inpatients, because we see that sometimes when it's verbal, we know this, but also the non-verbal cues are very important. It's not, if a young person is not being active or involved, he can be involved. And sometimes maybe we as healthcare professionals, we need to think a little bit more about that, because we coming sometimes in the rooms and we think it's annoying if they are playing on their games, and we think they don't listen, but be sure they're listening. And it's very important. If there is no verbal connection, stay connected in a non-verbal way also. Therefore, I think for making this connection and also feeling and breaking the loneliness, I think AYA nursing navigation is a very important aspect. It requires, of course, a lot of flexibility, but also it creates normalization in what is happening and in what is a difficult time for young persons, even we don't recognize it in their actions. So therefore, acting as a key contact for questions and concerns, then I think also this is relating beyond transition. And as we see, there are also already nurse navigation programs that starting with diagnosis up to survivorship. And that means that that person is the most consistent person with the young persons. And this maybe creates like a feeling of safety. Even we see other healthcare professionals, there is always one person that is the same person and where they can get with their questions. It's also providing individual support and education for their concerns at that moment, linking with the young person themselves, but also the parents and the siblings to hospital, but also beyond in the community resources is very important. And making that connection and also handing over, for example, a handover, a right handover. Connecting to the AYA support service, as we talked about, peer support is very important for young persons. It's also to creating that peer support in the hospital, but also making the connection in the community and in survivorship care. And very important, I think, is referring to multidisciplinary specialist services or more specialized services for young person when it's needed at that time. As we are continuing in life and making the digital connection also, it's important. I think we see that a lot of young persons are connected with digital tools, and maybe we as healthcare professionals are that not to do this or used to use it in the right way. But I think we need to help them to educate and guide them to the right support and have them getting connection to the right services also online, for example, in the digital world, because unfortunately there's also a lot of crap outside on the internet, and sometimes you see that Dr. Google as a way how they find the information, but not always the right information. But also we need to encourage young people to stay connected online, because that is also a great way to stay connected with their peers. But also being connected, we see that sometimes we are asked to be connected with young persons, and that's where coming in, for example, where we need, for example, making a big effort there, where we drawing the line a little bit between becoming friends from a person, if that's even possible, but also drawing the line that we still are professionals. And for sure, I think in your hospital, maybe you have guidelines or rules how to connect on social media with persons. And I think this is something where we need that connection to be like, or we as a professional need to draw the line how to connect to people outside or professional role. And this is an example from the American Society of Clinical Oncology, how you can connect on social media, or what are their recommendations on it if it's an active patient, a former patient connected. But maybe look into your hospital, maybe you have specific guidelines there also. Adherence to treatment, it was already mentioned, that is very important. And I think as nurses, we have a big responsibility here to increase the health literacy and why it's important to stay connected to treatment or adhere to your treatment. But we see that, yeah, treatment adherence is affected by several things, the emotional function, the illness severity, the family support that is outside, patient healthcare professional alliance, as we as healthcare professional have the relationship with our young person, and nursing interventions is really encouraged open dialogue and talking about like and listening, especially listening to the concerns of young people, especially to the treatment. Also very important is foster their hope, and not always on the long term, but on the short term. Like for example, look at the results and we will see, let's see how, let's follow up, but not of course confirm their hope, because hope can be also very difficult, and it's not as healthcare professionals to confirm it, but foster it. And of course, organization is very important. We know that, for example, treatment adherence is also related to good appointment making, to follow up, to stay connected with young people. So we as healthcare professionals, we need to implement this or make this happening in our hospital. And for example, not always thinking or labeling if people coming late, for example, that to say, yeah, he's always coming late or he's not coming now, then it's very important to look into it and how we can organize it or refer to services to support this, for example, in communication, but also for transport, for example. Another aspect, I think, where we are more confronted with as nurses, and that's mostly in a later stage, is like, for example, that they're all raising questions about like, what if treatment is not helping? Uh, Also, special maybe if it's more connected, these are questions that sometimes like we all feel it's hanging around, but nobody wants to address it. And this is also from these questions that coming up sometimes if people are alone with you. And there also we need to have to talk about with young people. What if treatment is not helping, if that question's coming up, or referring to, for example, to specialized services or palliative support teams to have that initial conversation. Uh, Next to the young persons, we have also, of course, the parents that are on the ward and mostly involved from the beginning to the from the treatment. And we see that mostly the brains of the young person work differently than the brains of the parents, and therefore sometimes we all need to mediate a little there, um, as we see that there are feelings of fear, powerless, guilt from both sides, and sometimes sometimes during treatment we are in the middle of it, and we need to guide them and bring them together, especially when they are all together sleeping over, for example, and being constantly on the wards. In our hospital, we developed like a booklet for parents also, and we identified by research and interviews by parents that they have like there are like a specific teams for parents also. So parents identify they want to take care. So as nurses, it's very important to sit together and see how they can provide that care and what they can do and what they not can do, and to make great rules about this. And this is very helpful for them also, for the parents. They manage your managers, and this was also identified because mostly they have also a life outside the clinic and they have to manage everything. For example, also driving children, other brothers or sisters to school, to hobbies, and how to balance between that all that relationships with other child, with their partner, with other children, but also in their entire social network or in their professional network. And sometimes they forget to get to self-care and how they can take about themselves in that difficult time when there is a lot of pressure on them. But also they have a lot of questions about the future. And also there it's important that we keep up the hope, but not always confirm them, and support them and refer them to specialized services as nursing. We talked about transition already, and the role of transition is very important to bridging between services, but also during treatments. And I want to just highlight where nurses can play an important role in making that transition, and, for example, making transition care plans, because we know that the consequences of creating a care gap, of losing patients in transition, is creating new health problems. They're more symptomatic, sorry, and there's 3 times more likely the need of an urgent intervention. So they need to be admitted by, for example, an emergency service, and there are more hospitalizations, and that is something we want to prevent. So creating that nursing survivorship care plan and transition plan is also very important. Also, considerations for survivorship care. I think many their needs different from those of adults, but also if we're looking to what could be long-term health or psychosocial factors, there are 2 things. This is a nice overview from that was published in BMG. What could be like, for example, long-term consequences for young persons. So, and this is very important to take care of, to create, for example, a survivorship care plan, and to increase their health literacy so that they can take that management for themselves when they're becoming a young adult or an adult. And we need to be clear from the hospitalization on that. But also behavioral and emotional survivorship considerations that are very important, and social relationships, because we see that, and that is also something that Ulrike already expressed, that AYA survivors experience significantly higher incidence of anxiety and depression and post-traumatic stress disorder than, for example, older cancer survivors. And that is something we need to be carefully consider in our survivorship care plans. And this is starting during treatment already. This is how we can create a survivorship, and how, for example, educational programming can help to create that quality of life and qualitative evaluation. And we see, for example, that an AYA nursing navigator system could be helpfully to navigate and making that transition to, for example, community physicians and nurse AYA survivorship education programs are very important. But there are a lot of factors that affected all these steps, and we need to consider this. So from the nursing perspective, I want to say AYA cancer nursing needs education and training, research and development. We need to take leadership in it. There is also a lot of care coordination involved from the beginning, from diagnosis during treatment to making that transition to late clinics or to adult clinics, the transition, but also to survivorship. And very important, I think, if young people needs to be involved to create value-based AYA cancer care, and this is from prevention to survivorship. As last, I want to give you this overview that was created by the Bright Light study, what they expected from healthcare professional and also from the nursing perspective is like we need to communicate with them with the different factors. We need to be knowledgeable. We need, of course, not always be serious, but also sometimes some humor, committed to care, listen to them, get them involved, but stay professional and be very skillfully that young persons ask, and also that we are very skillfully, because, for example, you know all that if it's very difficult, for example, to puncture, they will be hesitating, there will be fear, anxiety, and this is something we can prevent by taking care of all these findings. And I think it's not about only about nursing, but it's about thinking all the professionals. I think the best way to build excellence in AYA cancer care is building it together as a multidisciplinary team. And with this, I want to thank you for your attention.